Over the past 2 weeks, we've clearly seen a rise in the number of hospitalized patients, both in the ICU and even intubated patients. Over the past couple of days, we've really seen a steep rise, and we're now up to 24 inpatients, and 4 of those are on a breathing machine. We are aware of the governor's recommendations that gatherings be less than 10 people. My recommendation is make it a nuclear family Thanksgiving. Try to avoid as much as possible bringing in from folks from other places mixing at home. We are seeing significant community spread in almost every region of New York right now. And certainly, we're one of the states that has the least community spread. Well, what's happened so far? The weather has gotten colder, and we've seen our percent positive in New York State go from 1% or less to almost 3%. So we've seen a tripling of the prevalence in our community. Those conditions aren't going to change, and the pressure for all of us to be out and about and doing things may increase. So my short answer is yes. I think we have to be very careful, and all of us have to participate in trying to keep ourselves safe with the masking, social distancing, hand hygiene, and so important to be very conscious of not getting into large indoor groups. A couple of things. I think the rise in cases and the rise in hospitalizations has been slower. Recall at Ellis Hospital, we saw our first inpatient on March 17th. And within less than 3 weeks, really, April 6th, we were up to almost 40 patients in the hospital. Our accretion of cases has been slower. The other thing that's different is I think we're seeing more widespread disease in the community, such that I'm hearing about acquaintances, colleagues, even family members who are infected with COVID. Whereas that wasn't so much back in the spring, where so much was concentrated in high-risk groups, in particular the frail elderly, in congregate living situations. So it appears to be more of a diffuse process of disease spread now than it was in April and March. Right. So the state of New York, I think, is going to guide us in distribution. Storage of the vaccine, particularly the one that requires very cold temperatures, essentially minus 75 degrees centigrade, which is almost like minus 94 Fahrenheit, will present some issues. I think we're prepared here at Ellis to store a large amount of this vaccine, however. And then sorting out who's going to get it first, because the vaccine's going to come out in hunks of millions, not hunks of hundreds of millions, which would be required to vaccinate the entire population. Another big challenge that has been voiced is our population going to accept a vaccine in enough numbers such that herd immunity can be attained? And that does require over 70% of the population accepting the vaccine. And I know that surveys today suggest we're not there yet.